This is part 2 in a series of adolescent mental health disorders. We are looking at anxiety disorder, depression, and substance use disorder. Here are some terms that we'll be looking at in the next couple of videos. But no, first of all, the goal is to bring understanding. And anxiety disorder is the fight or flight mechanism unchecked. It is a physiological response to stress, real or imagined. Anxiety, we think of worry, apprehension. It doesn't always have to be that. Anger can be one of the results of an anxiety disorder. Now, understand emotions are a physiological response to change that promotes or promoted a survival behavior once upon a time. Think about an evolutionary perspective here. Cave people, when encountering certain situations, the 6 basic emotions: anger, fear, surprise, sadness, happiness, and disgust. These are all physiological responses that led human beings to do some sort of action that were good for the survival of our species. For example, anxiety pushed you to act, or fear pushed you to act. Joy pushed you to do certain things or rewarded you for certain things. You were disgusted with certain things, and that led to certain survival behaviors. So stress, a derivation of fear, enabled an organism to respond without thinking. Blood was shunted away from the organs to the muscles so you could do something. All right? Now, a little stress is good, but stress all the time is not good for the system. It's like the engine running at full speed. But know that we are hardwired not to get eaten. Our muscles tense. There's an increase in breathing rate. This state of hyperarousal, super awareness of the brain to sensory information. All right? The resources go from the brain to the muscles so that you are able to react. Fight or flight prepares you for this fight or flight. Redistribution of the blood, release of the stress hormones, increased sensory vigilance, facilitates the startle reflex, and alternate breathing, heart rate, blood pressure. All these things, this physiological response to stress. Now, this is great if you're running from a tiger, but not so great if you're sitting in a classroom trying to learn. Homeostasis is the ability of the body or the mind to regulate itself, to find this balance, this internal equilibrium, both physically and psychologically. The ability to regulate cognitive and emotional responses to fear. This is how we think about this in terms of an anxiety disorder. Think about it as a thermostat, a psychological thermostat, able to bring yourself back down. Mood dysregulation is when you are unable to regulate your moods, your emotions. You get more angry and you stay angrier longer, and it's harder to bring yourself down. It's hard to hit the reset button. It feels like you have a wolf inside of you. This psychological distress, you temporarily lose the ability to self-right yourself psychologically. Yes, we all get mad, we all feel emotions, but if you have a mood disorder, you're able to bring yourself back down. Looking at it this way, someone without a mood disorder, yes, they would feel anger or distress or sadness, they'd get here, but then they'd be able to bring themselves back down. They'd be able to regulate. If you have a mood disorder, you get more angry, more sad, more distressed, more whatever, and you stay that way longer, and it is much harder to bring yourself back down again. Anxiety disorder has a high rate of comorbidity. This means it happens with other things. Comorbidity, 2 or more conditions existing simultaneously. In this case, it tends to occur with depression and or substance abuse disorder. Now, mental health in schools can be diagnosed or misdiagnosed as an emotional behavioral disorder. And schools are not to diagnose mental health disorders, but we tend to schools do only on behaviors and not look at what causes the behavior. Mental health disorders can also be misdiagnosed as a learning disorder. It is very hard to learn if you are feeling anxiety or stress or fear. Think about that. The blood is shunted away from the brain to the survival organism, so you are not able to think. Now, depression has a chemical basis in the brain. It's not necessarily situation dependent. All right, people always want to figure out, why are you feeling this way? Well, it is a chemical response. There may be situations that exacerbate a pre-existing condition, but know that depression has a chemical basis in the brain. But it also has this two-way connection, depression and anxiety. When you feel bad, when something happens, you feel bad, but also when you feel bad, it connects you to memories of things that happened, either real or imagined. So it's this two-way connection, this two-way flow of things. And as I said, substance use disorder, alcohol and or cannabis are the most common, are often used to self-medicate or as coping mechanisms. So these things, especially with adolescents, can exist simultaneously, this comorbidity.